As per current major societal guidelines, ICD implantation is generally contraindicated, that is class 3, in clinical scenarios where the arrhythmic risk is transient, reversible or curable, or when survival with acceptable functional status is severely limited. Reversible or curable causes: acute myocardial infarction within 40 days of an acute MI. Early implantation in this window has failed to demonstrate a primary prevention survival benefit. Wearable cardioverter defibrillators are typically utilized as a bridge. Recent revascularization within 90 days of CABG or PCI to allow adequate time for myocardial recovery and reassessment of left ventricular ejection fraction. Transient triggers: VT or VF strictly due to completely reversible disorders such as acute ischemia, severe electrolyte derangements, or pro-arrhythmic drug toxicity, where correction is feasible and likely to prevent recurrence. Ablatable arrhythmias: VT or VF driven by mechanisms highly amenable to catheter or surgical ablation such as Wolff-Parkinson-White syndrome, RVOT-VT, idiopathic LV fascicular VT, or typical bundle branch reentrant VT. Refractory heart failure: NYHA class 4 heart failure symptoms that are refractory to guideline-directed medical therapy unless the patient is an active candidate for CRT-D, cardiac transplantation, or mechanical circulatory support like LVAD. Limited life expectancy: any systemic illness like metastatic malignancy, end-stage organ failure, or irreversible neurological damage that limits life expectancy with an acceptable functional status to less than 1 year. Inappropriate arrhythmia presentations: incessant arrhythmias, incessant VT or VF. Implantation in this setting guarantees continuous repeated shocks leading to extreme patient morbidity and rapid battery depletion. Unexplained syncope: syncope of unknown etiology in patients who have no structural heart disease and no inducible VT or VF during an electrophysiology study. Severe psychiatric disorders that preclude systemic clinical follow-up or that would be significantly exacerbated by the trauma of receiving ICD shocks.